Insights.
This is Akashvani. In the program Insights, now we bring a discussion on next-gen GST reforms, benefits for health and insurance sector. The participants are Deepshikha Sikarwar, economic analyst, and Sonu Sud, anchor.
On 3rd September, 56th meeting of the GST Council, chaired by Finance Minister Nirmala Sitharaman, approved next-generation GST reforms, rationalizing rates to a simplified two-slab structure.
Insurance services from 18% currently will go into 2-3 different categories. I'll say that to you. Exemption of GST on all individual life insurance policies, whether term life, ULIP or endowment policies, and reinsurance thereof, to make insurance affordable for common man and increase the insurance coverage in the country. Exemption of GST on all individual health insurance policies, including family floater policies and policies for senior citizens, and reinsurance thereof to make insurance affordable for the common man and increase the insurance coverage in the country.
To discuss the recommendations for the health and insurance sector and their implications for the common man, we have with us senior journalist Deepshikha Sikarwar. Deepshikha, warm welcome to you on Akashvani.
Thank you, Sonu.
Deepshikha, coming Monday, 22nd September, new GST rates will come into effect. If we talk specifically about the insurance sector, the GST on premium for all individual life and health insurance policies has been reduced from 18% to 0%. What, according to you, is the rationale behind this massive relief given by the government?
Last few months, and not specifically like last few months, but for some time, we've been hearing this debate, and many parliamentarians raise this issue about higher taxation on insurance. The fact is, the cost of healthcare or cost of insurance in the country, insurance has a very low penetration in India. It's about less than 4% or about 4% in India. And much more is needed to increase penetration of insurance products. Taxation is one way, one tool wherein government can provide that encouragement to the industry and also provide relief, encourage consumers to buy insurance products because these are much needed. And this demand which was coming from all corners, parliamentarians, industry also, one section of industry, consumers also, because the rate of 18% everybody felt was very, very steep, especially, if you have to cough up premiums. It was in that spirit to, give relief to consumers, to ensure that insurance sector also receives that encouragement to grow and to increase the penetration of insurance in the country. So with that objective, this decision was taken. This sector was included as part of the GST reform.
So, as you said that insurance is something which is very important, the value of which is felt, when there is some health crisis or some tragedy in a family, but it is not an essential product. So to that extent, you feel that this will lower the barrier to entry for first-time buyers and make financial security more widespread in our, country?
I'll disagree with you here, Sonu, in terms of it not being an essential product. We've seen what happened during COVID, how health expenditures can impact families, especially in the middle class, the lower rung of the society. So insurance, particularly health insurance, are much needed for people. Government has rightly so treated them as an essential category, and which is why this tax relief has been given. The idea is to provide that impetus to provide relief to consumers to go in for insurance products. If you see, government has its own Ayushman Yojana. It has attempted to provide a health cover to its citizens. But citizens also need to supplement it, and which is what, if it is cheaper, if it is affordable, they can do it much more effectively. It can be adapted very quickly and can be expanded. And I think hopefully this tax relief will allow this to happen.
You took the example of COVID. as you very rightly said, the crisis can strike any time, whether it's individual or whether it is something which is affecting everybody. So to that extent, do you feel that, as you said, that even the government has this vision of mission insurance for all by 2047, you feel that to convince the people on the lower rung of the economic ladder, there has to be more awareness also, where they can be made aware of the fact that how this is going to give them financial protection, and now it is more affordable, now it is more accessible. So you feel that that kind of awareness drive is also the need of the hour?
The insurance sector particularly, and if we see past experience with the insurance sector, insurance was treated as a investment product. It was wrongly sold also. Government has, the regulator has made those efforts to ensure that the right communication is being made and targeting is done in a proper way to sell. There is no mis-selling of products. And that said, I think in terms of industry also, because of the lower penetration, if you compare the industry with and the kind of products available in India with the products available overseas, you have products like spectacle or insurance. These are very specific products which are there, but they are there and they are quite popular. So the idea here is that you educate, and I think insurance companies, the regulator, they are on a regular basis making a lot of effort to bring out the importance, to highlight the importance of insurance in everyone's life. Why is it really needed? It is like a backup, preventing you or shielding you from any eventuality, shielding you or your family from an eventuality. How you prepare that, and that's what insurance is there to do. So I guess after these tax cuts, probably there would be much more impetus in the communication drive also and a marketing drive by insurance companies.
And apart from new people entering as insurance buyers, you think that this will make upgrades more feasible? Maybe higher sums will be insured by people without any cost implication. The saving that they'll do on GST, they will probably be motivated, you feel, to get themselves insured for higher sums?
Insurance companies have assured the government that, tax cuts would be passed on to the consumers. So, yes, they can structure the products, increase the premium in accordance with the tax relief that consumers are getting or the buyers are getting. Definitely, it works well both for consumers as well as the insurance companies, because you may spend similar amounts, but on your own insurance product, it sort of widens the bandwidth in that sense. So definitely it's a win-win for both the companies and the consumers.
Secretary General of the Indian Pharmaceutical Alliance, Sudarshan Jain, thanked Prime Minister Narendra Modi for reduction of GST in the health sector.
ये बहुत बड़ा स्टेप लिया है गवर्नमेंट ने एंड वी वुड लाइक टू थैंक द प्राइम मिनिस्टर. हेल्थ सेक्टर के लिए बहुत बड़ा है. एक तो इंश्योरेंस पॉलिसीज में किसने सोचा था जीएसटी रेट कम हो जाएगा. मेडिसिन में जो इसेंशियल ड्रग है उसको जीरो कर दिया है, तो कैंसर की मेडिसिन, रेयर डिजीज की मेडिसिन बहुत फायदा होगा पेशेंट को. फिर सभी मेडिसिन पे 12 to 5% कर दिया है, तो सभी मेडिसिन की कॉस्ट कम हो जाएगी.
And if you could just tell us which all policies are covered. What kind of individual life insurance policies and what all types of individual health insurance policies are covered?
All kinds of insurance products get covered. Protection plans, annuity, endowment, health insurance, definitely. The products that are covered, and government was very specific, and the GST Council was also very specific about it. The products that are witnessing a tax reduction are individual products. Okay. These cannot be corporate policies or companies buying, say, a fire insurance. But individual policies in all categories have seen this reduction in tax rates.
Including for senior citizen plans.
Absolutely, absolutely. There is no divergence or there is no distinction made on that. The only distinction which has been made by the GST Council and the government in their proposal was that this reduction should be for individuals. Because the idea was to benefit consumers, benefit people, citizens who really need this kind of cover. So that was the objective behind this exercise.
Ongoing life insurance policies, the next premium which will be paid after 22nd September, the GST element will be zero. Maybe last year was paid at 18% rate?
That is the whole idea, and this is the assurance that the insurance companies have given, that henceforth any premium paid for individual policies will not face the 18% tax. So that tax benefit, that tax would be reduced to zero for these.
Government has taken a very holistic approach. If we talk about the reduced rates on medicines and medical devices, which have also been announced, where 33 life-saving drugs, diagnostic kits, they from 12% the GST has been reduced straight to zero. And there are several other products, including Ayurveda, Unani, homeopathy. They're also from 12% to 5%. All these, changes which have been brought about in the GST, you think that this is giving access to healthcare in a very broad way for the common man?
Absolutely, Sonu, and I'd like to highlight one more point here. When the government is reducing tax rate on domestic medical devices or domestic medicines which are locally produced, commensurately there is a reduction on imported medicines also, because these medicines, imported medicines or imported equipment, face IGST, which is equivalent to that rate. So in the sense, and sometimes lot of the medicines, especially in critical care, or lot of equipment in critical care gets imported. So it's a huge, I would say, an impetus or boost, a support measure for the healthcare sector, for patients, especially, who are undergoing critical care. The cost of medicines are expected to come down. And also a lot of equipment, the cost of devices and equipment is expected to come down. So it will help, your hospitals upgrade, expand, in those areas. So in a way, there is a complete package here. At individual levels, you've cut down taxes on medicines. You've cut down taxes on devices. You've also cut down tax on the insurance, on health insurance products. So, on the other hand, you also cut down taxes on equipment that are consumed by the hospital sector. So, it's definitely, like you said, it's a very holistic sort of a decision, and a lot of care has been taken to, reduce taxes or move one product from one category to another category.
And you feel that this will also support domestic manufacturing in the pharma and medical equipment sectors?
Definitely. If you look at the entire revamp of GST this time around, the whole idea has been to address classification issues, address the input tax credit issues, and there's also a parallel exercise on procedural simplification. All these have been done besides the tax rate cuts to support local manufacturing. How competitive can you make local manufacturing? So not just healthcare or medicines, pharmaceutical sector or medical devices sector, but entire manufacturing. I think this GST revamp is expected to give a huge boost to the manufacturing sector.
So as you have said, I think already twice during our discussion, you're very hopeful that this GST reduction will be passed on to the consumers, and we will see the effect starting next
Absolutely.
week, giving us a festive cheer.
I think government has taken the lead. The public sector insurance providers have sort of assured the government that they will pass on the tax benefit. So it is likely that, that nudge is there for the private sector also to follow suit, because if, one public sector companies are doing it, then obviously they would not want their consumers or customers to move to those companies. So I think I am definitely hopeful that tax reductions would be passed on.
Thank you so much, Deepshikha, for this
Sonu,
discussion,
yes.
For this very, very important sector, health and insurance, how it is going to impact the common man, benefit the common man.
Thank you so much, Sonu.
You were listening to a discussion on Next Gen GST reforms, benefits for health and insurance sector. The participants were Deepshikha Sikarwar, Economic Analyst, and Sonu Sud, Anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on a mobile app, News on AIR. This program is also available on a YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 9289094044.
Insights.